We're so happy to have you with us today and happy to have our participants on Zoom and on Facebook Live. We only have about 20 minutes, so I'm going to jump right in with the first question, which is, how can I minimize pain in my knees?
Thank you for having me here. I think that's an interesting question, how to minimize pain in the knee. This is a very common problem. A lot of folks ask me the same question, and being a common question, it's a very well complicated answer because knee joint itself is a complicated joint with complicated biomechanics, and these complex biomechanics leads to different parts in the knee that can go bad and cause that pain. The first thing to know is to figure out what the problem is, to get the right diagnosis. And that entails a good thorough history, physical examination, imaging studies such as ultrasound, X-ray, and MRI. Once we know what the pain generator is, then we can target it and kind of solve the problem. Two strategies that we use to target and minimize knee pain, and I would recommend this to every patient, is first is physical therapy. So that's strengthening the muscles, targeted to the specific pain generator, and help get the load off. Now, this doesn't entail just with physical therapy. This also entails doing exercise at home. And the second strategy I recommend is oral pills, oral non-steroidal anti-inflammatory drugs such as Advil, Aleve. They help reduce the inflammation, help calm down the pain. We got to be careful that use these oral NSAIDs like Advil and Aleve. They can have detrimental effect on your kidneys and blood pressure if you use them on a long-term basis. So I also recommend my patients to use topical NSAIDs or topical non-steroidal anti-inflammatory drugs such as Voltaren gel or compound creams. They have a bunch of those in the market, but they have less systemic effects, so they have a less chance to go into your blood, into your system, and cause detrimental effects. So you can get those creams and rub those. Then the next thing in the puzzle is steroid injections or the cortisone injections. Those also help locally reduce inflammation, but again, we can only have 4 in a year. I recommend 3 to 4 in a year and no more than that. And then depending on what the problem is, if it's mostly arthritis, then there are injections such as gel injections or the hyaluronic acid injections, which help grease the arthritic joint, help provide nutrients to the cartilage, help regrow that cartilage a little bit. And the last thing in terms of the non-operative management to minimize knee pain is the stem cells or the PRP injections or the platelet-rich plasma. That's been a hot topic in the recent while. In the literature itself, there have been studies out there showing some benefit in knee arthritis, and we could do those injections. Once all these options exhausted of non-operative management to minimize knee pain, I think the last option is the surgical intervention. And depending on what the pathology is, which could be a meniscus tear, a ligamentous injury, that could require arthroscopic or a knee scope, as people would call it. And if it's arthritic joint with severe arthritis, you might be a total knee replacement to minimize that pain for good 20, 25 years.
A lot of options. So the next question is, what does arthritis do to the joints?
That's an interesting question. There are many types of arthritis. There are about 60 to 100 types of arthritis. The most common arthritis that exist are the osteoarthritis and the rheumatoid arthritis. Osteoarthritis is mostly the wear and tear arthritis. Rheumatoid arthritis is where your body or your own immune system attacks the cartilage. At the end of the day, in all kinds of arthritis, your cartilage is worn out and gone from the joint. What that leads to is bone and bone arthritis because now bones are rubbing on bones, and that's what you see in the x-rays. And most people refer to as, I got bone and bone severe arthritis. And that leads to inflammation. That leads to
we have a little bit of a delay here with Dr.
bow-legged. So that's what arthritis does to joints. It takes away the cartilage. Can you hear me? Can you hear me?
Yes.
I thought it froze for a few minutes, for a few seconds, I guess.
Here we go. We are back now. Okay. So let's start over with that last question. what does arthritis do to the joints?
Yeah, I guess the connection was weak. So I was saying that there are about different kinds of arthritis, but the two major ones, rheumatoid and osteoarthritis, that most people know about it. And osteoarthritis is the wear and tear. That's like we say, we're putting mileage on the car, mileage on the knees. Rheumatoid arthritis is more like your own immune system attacking the cartilage and wearing away the cartilage. No matter what arthritis we got, at the end of the day, your cartilage is worn out and you lose all the cartilage, leading to bone on bone. That's what we see on the x-rays. And that bone on bone causes inflammation, which causes their fluid in the joint, causing Baker's cysts, causing a lot of pain and discomfort. Once the bone is rubbing on bone, it causes erosion of the bone, leading to a deformity like being bow-legged or knock-kneed.
Okay.
Arthritis overall is a destructive process. It kind of erodes the bone, destroys that.
So as a follow-up to that, when should somebody who has arthritis seek intervention?
I think the biggest concern there is when you have arthritis, everybody has arthritis who's the age of over 30. They all have arthritis, but it's when it stops letting you do things in your life that you want to do on a daily basis. Like it interferes with your life. When you say, I can't go golfing because my knee hurts. I can't participate in an event because my knee hurts. I can't do this because my knee hurts or my hip hurts. I think that's the time when your quality of life starts to go down. And you should seek a doctor's opinion, such an orthopedic surgeon's opinion, to see where your arthritis is and what can be done about it. And having knee pain doesn't mean that you have arthritis. It could be other things that can cause this knee pain.
Okay, very good. Thank you. How does surgery with the Mako robot work?
So Mako robot, I think we're blessed that we have a Mako robot in our county, and we have it at our hospital, Buford Memorial, and we can use a Mako robot. Having done hundreds of these surgeries in my fellowship training at Lenox Hill Hospital in New York, Mako robot actually helps us make precise cuts with minimal soft tissue trauma and help us revise the knee with a great outcome over and over again, with minimal chances of error. How it works in a bird's eye view is we obtain a CT scan where we look at the arthritis and how the knee is functioning throughout the range of motion from 0 to 130 degrees. The surgeon then looks at live numbers during surgery and those data from the CT scan, and we put it in the computer and get a robotic arm to make the precise cuts needed to have a well-balanced knee. Well-balanced knee is very equal to having a car in alignment. And Mako robot really helps us do that with minimal soft tissue trauma and get that balanced knee over and over again. The only caveat is that your surgeon really needs to know that we input the right numbers in there and the right data in there to get the right output. So I think overall, Mako robot really helps us get that good outcome 99% of the time, repeatedly over and over again. And I think we're blessed to have that here.
Yes, absolutely. How long will it take me to recover from joint replacement surgery?
So it all depends on an individual. It's very specific about how long it takes to recover. In my practice, for example, hip replacements, I do my hip replacements with a direct entry approach to the hip. And we have patients up right after surgery, most of them going home the same day, starting aggressive physical therapy right after. And in about 4 to 5 weeks, they're done with physical therapy. And at 6 weeks' time, they can expect to go back to work, go back to golf, go back to pickleball, tennis, whatever quality of life that they were looking for, they can return back. So basically, they can resume the active lifestyle. In terms of knee replacement, the same idea with our minimally invasive knees that we do. You walk the same day, you have a one-night stay, you go home next day, start aggressive physical therapy. And at 6 weeks' time, you should be back to normal activities. And about 8 to 10 weeks' time, you should be back to your active lifestyle of golfing, tennis, pickleball, work, etc. And these numbers can vary plus or minus 2 weeks, depending on an individual situation. Also, if you had severe arthritis, you might have more releases, much more work done in there, which could prolong the recovery by a couple of weeks.
Okay, very good. How long does a hip or knee replacement last?
Well, with the current technology of implants, and that's the change in the plastic that we have, we're expecting anywhere from 20 to 25 years. Now, the older generation of implants, we expected 15 to 20 years, and they have well lasted 15 to 20 years. The newer generation with the new technology hasn't seen the 25 years, but we're expecting them then to go at least 25, if not more.
That's a long time. The next question is, how can I prepare for my joint replacement surgery to ensure an optimal outcome?
For joint replacement surgery, there are multiple factors that go into it. Like, for example, our hospital at Beefy Memorial has a whole joint team, a joint coordinator. So to prepare for yourself for a joint replacement, one is to mentally be prepared what you're expecting for. So the first thing I would suggest is talk to friends and family who've had a joint replacement, because that gives you a really somebody's perspective who's gone through it of what to expect. And it's different. Everybody's expectations are different, and everybody's going to experience it differently. But the first thing is to see somebody who has had it so that you can have an opinion. Second, talk to your orthopedic surgeon, see what they expect and what they expect out of you. What are they expecting? What kind of therapy are they going to expect aggressively afterwards? So the other thing to prepare on is your muscles, because that helps you recover faster. So if you have a good, strong muscles to go in, the soft tissues are strong, you're going to need less physical therapy afterwards. This is called prehab. And we have a program in the hospital called joint optimization, which lasts about 3 months before surgery. You do aggressive rehab to get prepared for that surgery. Now, instance of a hip replacement, when people's hip gets weaker, they start to limp. If you look at people who drop their pelvis when they walk, that's a limp because of the weak muscles. If you can strengthen those muscles before surgery, you got to put less work, and that's going to help you recover faster. The other thing to prepare for yourself is you want to make sure medically you're fit. If you have diabetes, if you have a little bit of extra weight, you might want to lose that extra weight and fix that diabetes a little bit better control so that you don't have risk of infections or any of the complications in surgery.
Very good. Thank you. So the next question is about diet and exercise before surgery. Are there specific things I should be eating and things that I should be doing to prepare for joint replacement surgery?
Well, if you look on the internet, there are a lot of specific diets people talk about in recovering from arthritis or preventing arthritis or stopping the flare-ups. There's no specific recommended diet, but one thing that's recommended is the vitamin D levels. We have seen with research over time, the people who have low vitamin D levels have a difficult time to recover from surgery. The second thing what we have seen is people who have a little bit of low protein content, measured with an albumin, also have higher chance of complications. So you want to eat healthy. You want to eat your grains. You want to eat your proteins. You want to make sure that you're healthy. You don't want to be lowering down your intake of diet, but you want to lower down the trans fats, but you want to have the proteins in there so you're healthy to go into surgery. Regarding the exercise, it's the same idea. If you have that muscle built up beforehand, you would have way less work to do after in terms of physical therapy, and it'll be much more easier to recover from a joint replacement. So the key things are eat healthy and have a good exercise plan at least about 2 to 3 months before surgery.
Okay, you've got to do the work. The next question is, how much pain will I experience after joint surgery?
This is a very complicated question because everybody is different, and pain tolerances from one individual to another different. But you do expect pain after surgery, but this is a different kind of pain that you had before surgery. And this pain lasts only about a week, 10 days to max 2 weeks. And then you should start getting this pain down. The pain you have is because we are taking about half an inch of bone all along for your knee replacement, And for a hip replacement, we're taking about an inch of bone out, and that's what causes the pain. But that arthritic pain is gone. So you do experience a bit of pain post-operatively, but that's very well managed by multimodal pain treatment options such as Tylenol, anti-inflammatories, a little bit of narcotics for the first week. And we do use specific local agents during surgery. And I think everybody at BFM Memorial uses that, where we inject something called Exparel, which is a long-acting 72-hour local anesthetic in the joint all along, so that you have some relief in the first 2 to 3 days.
Very important. I think that it might be easy to think that all your pain will go away after surgery. So it's important to know what to expect and how it will be managed. The next question is, will I be bedridden after surgery? And when can I return to work?
Well, we don't want you to be bedridden. The reason you do surgery is to get rid of that walker, cane, wheelchair, whatever you were using before. You should be walking right after surgery. Actually, I have a patient who I just did surgery last week who was wheelchair bound for 6 months. She had her hip replaced and she walked the first day 50 feet. And she's home doing physical therapy. And my recommendation to her is you're going to keep walking. You don't want to be in that wheelchair. You don't want to be bedridden, because that'll put you at a high risk for having medical complications such as heart problems, clotting in the legs. You could have your diabetes exacerbated, kidney problems. So you want to keep walking to get the swelling down and get that range of motion back. So we want you to be as active as possible after surgery and leave the bed and the recliner alone.
Very good. We've got time for one more question. How will I know when I need joint surgery?
Well, joint replacement is an elective procedure, and the spectrum of knee pain or hip pain goes on from mild, and it keeps debilitating people to a point where they can't do the activities they like to do on a daily basis. They're not able to play with their grandkids, kids, or do actually golfing, tennis. And that's when when you stop doing things that you want to do, and because of your joint, I think that's the right time to go ahead and get that joint replacement surgery. The other marker that I see is when people start to limp. A limp means that you have muscle weakness. And I think that's the time you want to start considering joint replacement seriously, because if you don't, you're going to keep limping more and more and have a harder time after surgery. The other thing I also see is with injections. So let's say people are used to having cortisone or gel injections every 6 months and doing fine. But when these injections and medications stop working, I think that's another key factor to consider and say, hey, I need to do something about this before it gets too bad.
Mm-hmm. Absolutely. Well, again, Dr. Sardana, we really appreciate your time today, and we appreciate all the questions from our participants and our viewers. If you would like to schedule an appointment with Dr. Sardana, you can see him in Okatee or in Beaufort, and his number is on the screen. Again, thank you all for joining us today, and have a great weekend.
Thank you.